Repeated pregnancy loss is an important health problem and affecting less than 5% of couple. There are various etiologies related to repeated pregnancy loss. A meta-analysis was conducted to specifically look into M2 haplotype as a genetic predisposition factor in pregnancy loss. ANXA5 protein is a calcium-dependent placental anticoagulant protein. It plays important roles in placental development. Since 2007, 4 consecutive nucleotide substitutions in the ANXA5 promoter region and has been discovered termed M2 haplotype. M2 haplotype has been shown to reduce ANXA5 protein, leading to increased risk of thrombotic event and impaired placental development, thus ensuing pregnancy loss. However, there are conflicting results from various case control studies regarding the association of M2 haplotype and repeated pregnancy loss. A meta-analysis was conducted based on the inclusion criteria of subjects where repeated pregnancy loss female. Repeated pregnancy loss was defined as 2 or more losses, pairs female control groups with at least 1 successful pregnancy and no history of miscarriage, and the prevalence of M2 haplotype or an indicative single nucleotide polymorphism of an ANXA5 gene had been analyzed. This resulted in recruitment of 14 studies with a pool of sample size, 4,664 subjects. This meta-analysis showed that M2 haplotype, either heterozygotes or homozygous in female subjects, have a significantly higher odds ratios of 1.54 times to have repeated pregnancy loss as compared to the normal haplotype. They have 1.63 times the odds to have consecutive repeated pregnancy loss, 1.94 times the odds to have consecutive idiopathic repeated pregnancy loss, and 1.92 times the odds to have early consecutive repeated pregnancy loss. Among the analysis, early consecutive idiopathic repeated pregnancy loss has the highest odds of 2.63 times. Focusing on couple population, M2 haplotype in couple population has significantly higher odds ratio of 1.48 times experiencing repeated pregnancy loss as compared to normal haplotype. This result implied that paternal M2 haplotype has at least an equal contribution in conferring higher risks in repeated pregnancy loss couples. This meta-analysis ascertains that women with M2 haplotype have higher risk in experiencing repeated pregnancy loss. The authors recommend screening of M2 haplotype as a panel of laboratory investigations for repeated pregnancy loss patients.